So, hello everyone. I hope you will be fine in the state of health. So, welcome to you all on this ISF College of Pharmacy Moga Punjab presents free online lecture series exclusively for B Pharm 8th semester students as per the strict compliance with the Pharmacy Council of India syllabus, followed by the question and answer series. So, you all are welcome to this series. Myself, Dr. SOURABH, KOSEY, working as Head and Associate Professor, Department of Pharmacy Practice, ISF College of Pharmacy, Moga, Punjab, India. And today I am over here to tell you specifically about Social and Preventive Pharmacy, Unit 1, one of its topic, poverty and health. So it's one of the main domain of social and preventive aspects of the health. So, as you know that ISF College of Pharmacy has always taken an initiative in terms of educating pharmaceutical sciences, research, and its new concomitant updates. So, in the similar fashion, we are going with this online lecture series, which is directly related to the social and preventive prophylaxis of disease condition and its survival. So any person who feels unhealthy, uneasiness, it's relatively due to the health prospects, and health is something which is generalized conditionable. So health is one of the determinants which consists of that the health related factors, health related parameters. This all the things are one of the determinants. So health related quality of life, health indicators, health determinants, health aspects. One has to go through with various conditions, health, personal hygiene, and various other aspects. So coming on to the today's topic, which is related to the health, also called as poverty and health. So poverty हिंदी में इसे कहते हैं गरीबी. So poverty is generalized condition where it may be due to certain kind of aspects which is called as health related aspect. So which is one of the indicator of poor health, and the integrated solutions are required henceforth. So poverty, which is called as one parameter or one segmented parameter related to the integrated effectivity of the health. So this integrated solutions are required in term of health. So when it comes to the health related complications, it seems that what are the etiology, what are the various reasons, what are the various pathophysiological aspects of the health. So health is a generalized situation which narrates, which tells that a person is healthy or unhealthy. So any uneasiness or any kind of discomfort or any kind of segmented division of the body which has to be covered is looked after in this segmented part of health. So as per the WHO, World Health Organization has defined as health is a social, mental, physical, economical, spiritual well-being of an individual is called as health. But when this health is not at a good aspect of the life, so at that time we have to see what we have to do to make it. So coming on to the this poverty part, we have to see the concept of health and disease. And in this concept of health and disease, this poverty is one of the factor which is affecting the health. So wherever when we talk about concept of health or dimension of health or the causation, web causation of disease, history, factors in prevention of disease, control of disease, various factors are over there. So various aspects are there in terms of disease prevention, disability limitation, and various multiple kind of segmented parts which are related for the health related concern. So what we have to see is that various health related conditions and health related aspect which can affect. So low family income, less access to food, safety, water safety, school, hunger, poor sanitation, lack of education, few work opportunity, disease, malnutrition, even death are various kind of problems which affect the poverty, and this is called as the cycle of the poverty. So what we have to see in this part is that nutrition, nourishment, and etc. So in our generalized way or manner, what we have seen typically that whenever it comes to the health related segments, whether it is a slum area, and the slum area you see that poor kind of hygienic situations, not being good living kind of situations where an individual can susceptibly survive. So this is affecting very hazardously, and particularly another segmented part which correlates with the health related segmented part is the slum area with improper kind of the proper sewage treatment methods are absolutely not followed over there. So this is one of the most retaining problems which comes up, and also some other segmented problems related part, like when it comes to the certainly slum area, people whomsoever are don't have access to the food, don't have the child who cannot particularly bears the problem related to certainly not getting access to the good food, etc. So particularly stating onto the segmented parts where the particular you can say the people don't have access to the health related segments or food, or particularly what we can say is people are much more hungry, people are not having access to the basic needs of the life, like clothes or food. So below poverty syllabus. So today I am going to discuss poverty and health. My name is Dr. SOURABH, KOSEY, working as Head and Associate Professor, Department of Pharmacy Practice, ISFCP College of Pharmacy, Moga, Punjab. In this subject, social and preventive pharmacy, we are going to discuss today about poverty and health. So, poverty is one of the section of the society where the peoples with low socioeconomic status, low nutrient diet, low income resources, and more number of family members are one of the major problems which correlates into the this segmented part. So, the mainframe problem which comes with the kind of this society which relates is the uh, part which is responsible for the this growth of the human body. So this integrated solutions are required. So poverty cycles work with the health infrastructure, quality of life, health determinants, and health-related aspects of the life. So poverty is generalized situation where in the slum area you see the basic schooling or the segmented part which are related to the one of the poor sewage problem is one of the problem where the things goes, and also people are not getting the health related segmented part food, or food if it is available it is not too much kind of, you can say, insufficient amount to the people who want to eat it, or number of the size of the family is quite big. So this is certainly one of the problem. Then coming on to the part which is more overpopulation. So urbanization is also another aspect where you see the one area is a slum area, and another area is, as you can see, one of the growthest part of the area. So this growth area, which what we considered is as growth, but at the another part of the segmented part, you will see that the slum area where the industrial sewage water, drinking, sanitation, hygienic, this situations gets poor, and the health related segmented dimensions get distributed. So people's also in the pandemic time, what we have seen generalized level, the peoples are in the line in the queue to get the food, get the job, employment status, and everything. So what we have to see that every individual get food, good health, good quality of life, good water, good climate, good kind of health related sustainable development goals and millennium goals. So health poverty, what we have to see, we have to take as an action, or the I can say certainly the resource generation, what we have to done, so that the people can get a good quality of life, food, shelter, and the basic necessities of the life called as the job prospects, and various job rules, like people do have to rely for their life, like till all day they works, and in the night they spend their nights in the shelter homes and the places, etc. So this is also one of the factor determinant related to health. Their certainly workflow, manner flow, and shelter is another one of the aspect which do affect, and people living in slums into the rainy season, and various other kind of geographical workflow which directly indirectly relate to the health. So out of it, poverty is one of the what we can say is segment which usually affect, and the food preparation, and the certain kind of resources from the food and the fruits are being occupied and prepared and stored and used. It is one of the factor which relate to the directly with the poverty. So health segments and generation of food and food for all the things. And migration is another parameter in the poverty. Migration means like certainly loss of job, or can say the higher kind of increased rate of the basic necessities, food, or say shelters, or etc. So various lot of things which correlates or determines the segments of the health related, quality related aspects of the this segmented value process is responsible for the health. So migration means, when certainly in the COVID pandemic also we have seen people migrated from one place to another place. So this is one of the thing which made a huge kind of difference into the segmented workflow. And people's living on the footpath and the street or don't have proper shelter homes, also one of the responsibility for the taken up for the poverty. Slums are also one of the reason that there are no responsibility. Slums also are at place where people are living in a overcrowded place. People are not tend to get good nourished diet, and certainly we can charge up that yes, we can arrange, we can see, we can tell that at the peoples living at certain kind of place are more vulnerable to have this rare possession of the disease. People's migrating from one place to another, also one of the segmented part which do affect. And certainly what we have to see the main framework, that at one of the place, one of the part where we can come to a concomitant part, that yes, specifically we can work onto the poor sanitization, poor workflow of the poverty and its related infra. So coming on to the basic part of the food, of the health, what we have to see, we have to supply, we have to generate a consciousness of mind. And in this mind, we have to see that what are the various factors which do, we can say, effect. So living capacity, first of all, at a place where the living capacity, peoples are living at a place, and when the peoples are living at the place, they usually tend to see generalize in a generalized manner that if people are living at a overcrowded place at a singular time, then there are more tends to be one of the strategy called as the things may affect in correlation. So overcrowding leads to breathing kind of problem. Overcrowding leads to certain kind of suspected airborne or communicable diseases also. And medical hygiene, though although has to be maintained, either it is pandemic or not, because like certain kind of diseases like tuberculosis or COVID-19, etc., are the opportunistic infections which generally do attacks, or do, we can say, target to our certainly we can say to the body. And then food is another aspect. When the food is not at a proper segmented level, not properly seen distributed at one place, this also affects. So food is one of the major kind of problem which we can see, which can we can tell that yes, food, any malnutrition or related kind of problems are one problem which relates it. So for the food segmented part, we have to see that food has to be taken up with good nutritional status, and particularly uh, this nutrition status should not undergo in a length. So nutrition as a quality to each and everyone, and the nutrients coming from the primary and secondary metabolites, and any vitamin or mineral If it's a deficiency in the body, it leads to various kind of growth disorders such as anemia, kwashiorkor, marasmus, scurvy, sickle cell anemia, etc. diseases. And another health related aspects which in the poverty come is the certainly the universal immunization programs, follow up of the vaccinations to the newborn from the age of 0 days to coming with the doses followed by the growth doses called booster doses has to be accompanied after a interval. So the roles of ANM, JNM, ASHA, USHA worker and national health missions and national health rural mission and urban missions plays a vital kind of role which is required nowadays. So coming on to the health related segments and aspects, once if we are going with this health related aspects, domain facilities are required to provide certain health needs requirements to all kind of society peoples living in a community standard. So provision of over the counter medicines, prescription medicines, other pharmacies. So the biggest problem as on earth is the overpopulation, which is the one more foremost important factor which affect the poverty and the health. And overpopulation leads to minimization of the resources for education, for child health, for maternal health, for reproductive health. So overpopulation, and afterwards the second thing which comes up, the requirement of the health infrastructure, which is not that much or that much strong, which is so health screening services. Either it is capillary blood glucose, blood pressure monitoring, or cholesterol screening, or general health checkup, etc. have to be inculcated to cross check that what kind of health related assembly and management we can do up in a typical manner. So now coming on to the segmented part, like what are the solutions to the poverty? So poverty basically, you can see that uh, high income resources peoples can in the local community can take charge of manufacturing and the production and the resource generation. And certainly one of the another parameter which comes up to the higher level of the you can say the evidences, then the market kind of interfacing distribution of local company and licensing with the good government segment is one of the thing. And royalty free technology license manufacturing, international funding or philanthropy network collaboration. So this things which can go. So ultimately the solutions for the poverty management is sustainable development goal. So as you can see, before it on to the global peace, Millennium Development Goal and the Sustainable Development Goal as a part of the we can say the health related development or reduction of illness or sickness. So the first is there should be no poverty. Second thing is everybody should have good amount of quality processed food, and the hunger related deaths or the disorders should not occur at all. Third thing which comes up is a good health and well-being. So health is the constitutional right of an individual. You have to be in a good state of health, good quality of health and well-being. And the foremost, the fourth sustainable development goal, which comes up as the quality education, taking up onto the social, physical, spiritual, and mental well-being of an individual. There should be a good amount of quality education served, provided to one of the individual. And then come up onto the next segmented part is the gender equality. So there should not be inequality either it's a male child or female child. So both of them have the right kind of chances, right kind of growth parameters. Next is the clean water and the sanitation. Clean water and sanitation is generalized level. We see that uh, water of any kind of mineral resources or rivers or ponds or dams, any place where you store the water, it should be clean, and when it is used, it should be sanitation process, water treatment plant, etc. has to be gone. Then the next comes is the affordable and clean energy conversation, because this too required for the creation of jobs and mechanical aspects of the life and workflow. The recent work and economic growth, there should be good per person capita and chances of growth retention as per her own experience. The ninth one is industry innovation and infrastructure, the information technology, the industries, the sort of small scale and large scale enterprises, entrepreneurship, innovations, startups, etc. should take more kind of ideathon, hackathon, competitions or etc. in the society to work with the persons coming with the entrepreneurship, which they can give more chances to the peoples from the society, and then they reduce inequality, sustainable cities and communities of the places, and then comes up the responsible consumption and production. uh, when the climate action, climate is one of the thing which is responsible for the, we can say that climate is one of the parameter of any kind of change in the society. So life below water, life on land, peace, justice, and strong institutions, partnerships for the goal, etc., has to be taken up as sustainable development goals. So when it comes to the Center for, we can say, Center for Research and Development of the Humanity, to alleviate poverty in the CRD, youth recommendation is improve access to affordable housing, so shelter, increases access to ethical and local foods, support projects, events, and arts that enhance community, create accessible opportunities for eco-friendly and environmentally sustainable practices, encourage multiple form of accessible public transit, improve quality and affordable child care program and spaces, create a sustainable local community accessible to diverse populations, sustain programs, projects supporting population and particularly by sex, gender, race, ability, and by mother tongue, motherhood, encourage positive inclusion of young people with various forms of education in the local economy, include young people in decision making processes at the local and regional level. So education is the only way to escape poverty and to get a hard life success, Sir Benjamin Carson, a neurosurgeon, stated. So the arc of system change comprises of listening, analyzing, identifying, implementing, and evaluating the art how to reduce the situation conditional polarity. So basic education. So what we say is the knowledge is the proper tool to empower yourself. Knowledge nobody can steal from you, right? So what we have to see a universal basic income per person capita and GDP growth, and what is the national and the international global scenario as concerned with the income processes. So the poverty, which is the general scarcity or debt or the state on which one who lacks a certain amount of material possession money, and United Nations have said that the fundamentally poverty is the inability of getting choices, opportunity, the violation of human dignity. It means lack of basic capacity to participate effectively in society. It means not having enough to feed and clothe to family, not having a school clinic to go to, not having the land on which to grow one's food or job to earn one living, not having access to credit. It means insecurity, powerlessness, exclusion of individuals, households, and communities. It means susceptibility to violence and often implies living in marginal or fragile environments without access to clean water or sanitation. So, World Bank has stated that the poverty is pronounced deprivation in well-being, comprises many dimensions, and includes low incomes, inability to acquire the basic goods, services necessary for survival and dignity. Poverty also encompasses with the low levels of health, education, poor access to clean water, sanitation, inadequate physical security, lack of voice, insufficient capacity, and opportunity to better one's life. So IEC activity takes place, which is called as information, education, communication. So the cycle of poverty, which is the less of safe food, water, healthcare, low family income, depleted unskilled workforce, unemployment, few work opportunities, disease, malnutrition, even death, hunger, poor sanitation, lack of education, etc. So when we talk about the international and national scenario, global poverty rate is for 14.5%, where the country with the highest poverty is Haiti 77%, and India ranks 43 nationally on poverty rate scale, which is 23.6, but based on national poverty line, poverty rate is 21.9%. Rural India 25.7 percentage. Urban India is 13.7 percentage. Poorest rate is in the state of Chhattisgarh with 39.93%. As per the World Bank report 2014, Press Report Planning Commission 2014, poverty decline, which we have to see in the rural and the urban population, we have to check up, mug up with one of the process which is called as the despite stagnation in the job creation, accelerating the prices of the basic necessities. So employment generation, inflation ratio, poverty has to be certainly covered up in this segmented part and the ratio. So the poverty decline, etc. So indicator of poverty, poverty rate, poverty gap, poverty severity index, human poverty index, human development index, multidimensional poverty index. So poverty rate, number of people in a community who falls below poverty line BPL, one of the most popular measure of income poverty, but it does not provide the intensity of the poverty. Poverty gap, it's measure between the intensity of poverty. Disproportionate income shortfalls below the poverty line for all the poor in terms of money. So at present, India is at 4.8 percentage, and example is poverty gap ignores the effect of inequality. Like the example, the poor gap for both cases is the same, even though the first case he has one household with rupees of 300 income per month and experiencing a more severe state of poverty. So poverty severity index, it is defined as the average of the square relative poverty gap of the poor. It takes inequality among the poor into the account. So human poverty index P1 probability at birth of not surviving to age 40, and P2 is adult illiteracy rate. P3 is unweighted average of population without sustainable access to an improved water source and children underweight of age not used. Now it is being replaced by MPI. Human Development Index, the following three indices are used: Life Expectancy Index, which is LE minus 20, YD5 minus 20, Education Index, EIS, MYSI plus EYSI by 2, mean years of schooling index is MSY divided by 15, then the expected ratio of the schooling index, EYS by 18, income index is equals to this one. So these are the formulas where the global human development index is 0.7, not two lowest human development index in the Nigeria country 0.337, where the India is 0.586 and J rank is 155 among the world. Multidimensional poverty index developed in 2025, where it is predicted by the United Nations Development Program to be replaced by the previous human poverty index, and which uses different factors to determine poverty beyond income is less generally used for developing nations, where the dimensions for the multidimensional MPI, multidimensional poverty index, should be health, education, living standard, child mortality, nutrition, years of schools, children enrolled, cooking fuel, toilet, water, electricity, floor, assets. So MPI is calculated as MPI is equals to H multiplied by A, where the H is a percentage of people who are MPI poor, incidence of poverty. A is average intensity of MPI, poverty across the poor percentage. So multidimensional poverty index that India is 0.32, where the country with the worst MPI is Nigeria is 0.692. So, which I could say that poverty and equality in health, there is a famous cartoonist that judging from this X-ray films, once I would say that your health is way below the poverty line. So the reality, poverty states the poor economical status to richness, and the poor are those who are below the poverty line. Poverty impedes progress all factors of human life, housing, sanitation, getting healthcare services, dietary intake, etc., resulting in increase in mortality and morbidity. And the causes of poverty: rapid population growth among the poor, low rate of economic development, unemployment, growth strategy, inequalities of income, little trickle down effect of economic development, backwardness of agriculture, inadequate anti poverty measures, low education, inflationary rise in price, socio-cultural factors, political factors, etc. So, how to measure the socio-economic status based on the three variables: education, occupation, and income. So, based on three methods: BG Prasad methods, Kuppuswamy methods, Pratik's method, BPL is calculated. It is defined as a cutoff line of per capita monthly income below which it is not possible to purchase food as to obtain minimum desirable limit of energy, which is 2400 kilocalorie person per day in rural areas and 2100 kilocalorie in urban areas. So they fall below class 5 according to the BG Prasad's committee. Poverty is also associated with various social factors such as literacy, ignorance, lack of knowledge, poor living condition, overcrowding, blind beliefs, taboos, or the kind of rituals which are very old-fashioned stereotype. So poverty leads to sickness and health hazard of poverty, various communicable diseases such as waterborne, foodborne, respiratory, and sexually transmitted infections, including gonorrhea, syphilis, and HIV, non-communicable diseases, malnutrition, anemia, and certainly vitamin and mineral deficiency, social problem, prostitution, drug addiction, alcoholism, family disintegration, antisocial behavior, beggary, violence, delinquency, and terrorism takes place. Mental problems like depression, loneliness, inferiority complex, suicidal tendency, scabies, dental caries, and pediculasis. So, poverty in the world view based on the World Bank group, where according to the most recent estimates in 2015, 10% of the world's population lived on less than US dollar 1.90 on a day, compared to 11% in 2013, that down from nearly 36% in 1990. Nearly 1.1 billion fewer people are living in extreme poverty than in 1990. In 2015, 736 million people lived on less than $2 a day from the billion 1990. So poverty rates have been declined in all regions, but progress have been uneven, and ultimately by the time the poverty has been increased. So in 2030, there will be a lot of problem. Access to good school, healthcare, electricity, safe water, critical services remain out of reach of many peoples, often determined by socioeconomic status, gender, ethnicity, geography. Moreover, for those who have been able to move out of the poverty, progress often temporary. Economic shocks, food insecurity, climate change threaten to rob them of their hard-won gains and force them back into the poverty. It will be critical to find ways to tackle these issues as we make progress forward in the 2030. So, as we poverty in the India, if we see the 2012, there were a lot of good poors were available. 1 in 5 Indians were poor, and certainly they were low socioeconomic status, and they don't have house, food, shelter. And in the rural population, 90% was rural. Number of people were not suffering with the good. And many states like Madhya Pradesh, Uttar Pradesh, Bihar, Jharkhand, Odisha, Chhattisgarh, Rajasthan were suffering with the number of poor of income in the low income states in the millions. So how to work in India, this BPL card, Janni Suraksha Yojana scheme, National Maternity Benefit Scheme, Insurance of Women Workers, Bhagya Lakshmi scheme, Social Assistance, Prasuti, Arike. So what is the inequality in health? Health inequality or disparities can be defined as difference in the health status or in the distribution of health determinants between different population groups. So social community networks, age, sex, constitutional factors, general socio-economic, cultures, environmental conditions. So there are a lot of kind of, we can say that the factors which affects the health, disparities, inequalities, treatment not given to the patients, and the partialities, clinical factors, the stage of disease presentation, comorbidities, severity disease of taken into account or not across the range of clinical settings, including public, private hospitals, teaching, non-teaching hospitals, disparities in cares and are associated with higher mortality rates. So this is what is nowadays with the disease burden, health uh, burden is increasing. So the scenario of inequality, fundamental causes are over there. So like global economical forces, macro socio-political environment, political priorities, decisions, societal values to equity and fairness, unequal distribution of income, power, wealth, poverty, marginalization, discrimination, economic and work, physical learning services, social and cultural, economic and work, physical learning services, social, interpersonal, inequality in well-being, healthy life expectancy, morbidity, mortality. And these are the top 10 most committed countries to reduce include Denmark, Germany, Finland, Austria, Belgium, Norway, Sweden, France, Iceland, Luxembourg. 10 least committed countries: Nigeria, Uzbekistan, Haiti, Kosovo, Chad, Sierra Leone, Madagascar, Tonga, Bhutan, and Singapore. So, how could well-meaning and highly educated health professionals working in their usual circumstances with diverse population of patients create a pattern of care that appears to be discriminatory? So, inequalities which leads to particularly public-private dichotomy, human resources, mean of marginalized population, escalation of health costs, consumer expectation, etc. So how to overcome poverty and inequality in health? Legal regulatory framework is required, health system investigations, interventions, education, data collection, monitoring, research, increase health care providers awareness of disparity. And come is the SDG is called as the Sustainable Development Goals, a universal call to action to end poverty, protect the planet, ensure that all people enjoy peace and prosperity, which are born at the United Nations Conference on the Sustainable Development in the Rio de Janeiro in the year 2012. The objective was to produce a set of universal goals that meet the urgent environmental, political, and economical challenges facing our world. So, his Sustainable Development Goals have to replace this Millennium Development Goal, which started a global effect in 2000 to tackle the indignity of poverty, which have more than 1 million people have been lifted out of the extreme poverty since 1990. Child mortality rate has been dropped by more than half since 1990. The number of out-of-school children have dropped by more than half, and HIV/AIDS infections fell by almost 40%. So the Sustainable Development Goals came into effect in January 2016, and they will continue to guide UNDP policy funding until 2030. As the lead United Nations Development Agency is unequally placed to help implement the goals through our work in some 170 countries and territories. Cutoff for below poverty line in India, international poverty line is 1.25 US billion dollar. Tendulkar committee cutoff, Rangarajan committee is around $1. So, how the cutoff is calculated on the basis of household consumer expenditure like food, health, education, clothing. Household consumption expenditure like consumption of food, pan, tobacco, intoxicants for last 30 days. Consumption of fuel for cooking, lighting, other purposes excluding convenience during the last 30 days. Consumption of clothing, bedding, etc. during the last 365 days. Consumption of footwear during the last 365 days. Expenditure on education, medical, institutional goods, services during the last 365 days. Expenditure on miscellaneous goods, services including medical, non-institutional rents and taxes during the last 30 days. Expenditure for purchase, construction including repair, maintenance for durable goods for domestic use during the last 365 days. And the committees have given various their ratios per person capita and Tendulkar formula diversity poverty decline which have told the ratio in the crores number of poor and which comes up into the rural and the urban population. So poverty and health, poverty versus hunger is poverty versus disease, poverty versus access to basic health services, poverty versus water and sanitation, poverty versus education, poverty versus life expectancy. There are a lot of factors which affects Europe, Central Asia, Latin America, Caribbean countries, Middle East, North America, developing world, South Asia, Sahara, and Africa, East Africa, and Pacific. So the developed regions and the developing regions where they have to see the undernourishment part also. No, so the prevalence related to the before 10 years, this was the percentage population and poverty averages in India 22%, world 18, and certain kind of population aspects. So, mortality rate, ratio, poverty elevation, which is through the income assistance, food assistance, social security assistance, housing assistance, sanitation assistance, universal health care, education. For the income assistance, which come with the Mahatma Gandhi National Rural Employment Guarantee Act, Magrena, and the National Livelihood Mission, RLN, and Urban Swan Jayanti, Sahari Rozgar Yojana, SJSRY. Food assistance, food security bill targeted PDS 5 kg food grain capita per month at the rate rupees 3 per kg rice, rupees 2 per kg wheat, rupees 1 per kg millet. Antyodaya Anna Yojana 35 kg food per grain household per month, rupees 3 per kg rice, 2 kg per kg wheat. Annapurna scheme for its free 10 kg food, grains, and certainly the month. Social security assistance, health insurance, Rashtriya Swasthya Bima Yojana, universal social security, and Jan Dhan Yojana, Indra Awas Yojana, total sanitation campaign. So poverty and equality are partners in crime. So more unequal the income distribution in a country, state or city, the lower the life expectancy for people in all income levels. The bigger the income gap between rich and poor, the less inclined the well-off are to pay taxes for public services they either do not use or use in low proportion to the taxes they pay. So this is what we have to do at International Day for Eradication of Poverty, celebrated every year at 17th October, where we have to leave no one behind thing, decide that let's fight poverty. And Bill Gates have stated that if you born poor, it's not your mistake, but if you die poor, it's your mistake. So poverty is just not an absence of income, but poverty is presence of helplessness, powerlessness, and voicelessness. So, ladies and gentlemen, thank you so much for watching this lecture. And if you have any question, you can write in the chat directly so that we can answer. So as I was watching the YouTube chat, there were no certain questions. So thank you so much for watching this section, and for further updates of further subjects and more informational sessions, do subscribe our YouTube channel, that is ISF College of Pharmacy, Moga, Punjab, India. And I'm thankful to engineer Paneet Kumar ji for handling this YouTube session. And I'm also thankful to ISF College of Pharmacy, Professor G.D. Gupta, Dr. R.K. Naran, uh, Shri Praveen Garg ji, Chairman, Engineer Janesh Garg, and all the HODs, all the students, and all the participants of this of this lecture series. Thank you so much.